So good day class, I am Ma'am Blessy Bondok, your teacher in physical education. So before we start, may I request everyone to please sit properly for our opening prayer. So Ami, will you please lead the prayer?
We offer you, God, our studies and our prayers, and we beg you to enlighten our minds and make us ever pleasing to you. Amen.
Amen. So before we proceed to the discussion, let us check your attendance first. So please open your cameras and I will take a screenshot which will serve as your attendance for today. So 1, 2, 3, smile. So before we start our lesson, let me discuss first the rules that you will follow during the discussion. So first, go to a place where you are comfortable, safe, and make sure that your internet connection is secure and stable. And wear proper uniform or any formal clothes that will make you look presentable. Next, keep your camera on during the discussion. And fourth, mute your microphone if you don't have anything to say unless it is your turn to speak. And fifth, raise your hand if you want to answer and if there is something that you want to say, or use the chat box if you want, or if you have any question that. And last, focus, pay attention, listen, and be participative. So, are we clear with the rules, class?
Yes, ma'am.
Okay, so before we move to the discussion, so let me check if you acquired the previous lesson that we tackled last meeting. So let's have a short review about our previous lesson. Class, who among you remember the topic from the previous lesson? Anyone?
Ma'am,
Yes, Ami.
ma'am, our topic last meeting is all about changes in health dimension during puberty.
So thank you. Very good, you are correct. The topic that we discussed last meeting is all about changes in health during puberty. So, so to make sure that you remember the previous lesson that we discussed, let's have a game. So this game is called Arrange Me. So for the instruction, the teacher will present a picture with jumbled letters. And you need to analyze the jumbled letters based on what the picture described to get the correct answer. And the student who wants to answer will chat me in the chat box. And based on those students who type me in the chat box, I will choose randomly to give his or her answer. So is that clear, class? Any question regarding to the direction?
None, ma'am.
Okay, so let's begin. So for the first word, so may I call Gerald? What is your answer?
I think it is puberty, ma'am.
So let's see if your answer is correct. Very good, Gerald. You got the correct answer. So again, based on what we discussed last meeting, puberty is the time when all your major organs and body systems mature. At the end of puberty, you are sexually and reproductively mature. And the growth and development that occurs during puberty is prompted by changes in the levels of certain hormones in your body. So, okay, let's move to the next jumbled letters. So anyone who wants to answer? Any volunteer?
Ma'am,
Yes, Ami. What is your answer?
bad taste.
Okay, let's see if your answer is correct. So very good, Ami. Your answer is correct. So the shape of your body will change when you get adult. Your hips will widen and your body will get curvier. And there may be an increase not only in the height and weight, but the hips may get wider as well. And they may also be an increase in fat in the buttocks, legs, and stomach. So next, so anyone who wants to answer?
Ma'am, ako.
Okay, Nayame, what is your answer? So very good. It let's see. So very good, Nayame, you got the correct answer. So you will grow taller and they grow just 1 to 2 additional inches in the year or two after getting their first period. This is when they reach their adult height. Most girls reach their adult height by age of 14 or 15. So next, anyone who wants to answer? I want to hear your voice, Romalyn. Okay,
Acne?
let's go. Romalyn, what is your answer?
Acne.
So let's see if you are correct. So very good, Romalyn. You got the correct answer. So you may develop acne. This is a condition of the skin that shows up as bumps, most commonly on the face, neck, shoulders, upper back, and chest. These bumps can be blackheads, whiteheads, pimples, or cysts. Hormonal changes during puberty cause acne in teens. So well done, class. So let's move to the next activity. And it seems that you really understand our topic last meeting. So I think it's time for us to move on our next topic, which we are going to discuss this morning. So are you excited, class?
Yes, ma'am.
Okay, before I introduce the topic that we are going to discuss for today, since you don't have any idea about the topic that we are going to discuss, let us play another game for you to have an idea about it. And this game is what we call word problem. So for the instructions, identify the picture given to solve word problems. And if you want to answer, you just have to do this. State your surname and smile. Did I make myself clear, class? Okay, let's begin to the game. So for the first word problem, anyone who wants to answer? Gerald. What is your answer? Yes, Gerald.
Ma'am, I think it's anxiety.
So let's see if your answer is correct. So very good, Gerald. You got the correct answer. So let's move to the next word problem. So any volunteer? Anyone who wants to answer?
Ma'am, Bondok.
Yes, Ami. What is your answer?
Bipolar disorder, ma'am.
So let's see if your answer is correct. So yes, bipolar disorder. You are correct. Very good, Ami. Next. Anyone who wants to answer?
Ma'am,
Yes, Ami. What is your answer?
dementia, ma'am.
Are you sure?
Sorry, ma'am. Eating disorder po.
Okay, let's see if your answer is correct. So very good, Ami. You got the correct answer. So let's move to the last word problem. So class, please participate because I will give you a reward if you are active. The most active students will give, I will give a reward. So anyone who wants to answer? Okay, Gerald, what is your answer?
Ma'am, it is it dementia po.
Okay, let's see if your answer is correct. So very good, Gerald. It's dementia. So now, thank you for participating, class. So now, based on the game or short activity that we did earlier, what do you think is our topic for this morning? Anyone from the class?
Ma'am.
Yes, Ami.
Ma'am, I think our topic for today is all about common mental disorder.
So yes, exactly. The topic that we are going to discuss this morning is all about common mental disorders. So for the objectives, at the end of the lesson, the student should be able to first identify common mental disorders, discuss the types and signs of common mental disorder, and appreciate the importance of knowing the types, signs, symptoms, prevention, and professional care in managing common mental disorders. So let's begin to the discussion. So anyone from the class who have an idea what is mental disorder?
Ma'am,
Yes, Gerald.
it is a psychological disorder of thought or emotion.
Oh, very good. So mental disorders or mental illness are conditions that affect your thinking, feeling, mood, and behavior. So they may be occasional or long-lasting or chronic. They can affect your ability to relate to others and function each day. So are we clear of what is mental disorder? If yes, let us move to the types, signs, symptoms of common mental disorder.
Yes, ma'am.
So there are a number of factors that can play a role. While there are numbers mental health disorders, some are more common than others. So there is no way to know for certain if a person will develop a mental health condition in their lifetime. But there are some factors that may put them at greater risk. Family history or mental health disorders, childhood trauma, and social influences may put some at higher risk than others. Some of the most common mental health disorders are seen are, so for the first type, anyone who wants to read what's on the slide?
Um, depression.
Yes,
Depression is a
Gerald.
Depression is characterized by general feelings of sadness, lack of interest in activities once enjoyed, exhaustion, inability to concentrate, and changes in sleeping and eating patterns.
Okay, thank you. So there are a number of factors that can play a role in its development. So family history, life events, medical conditions, and side effects of medication can all cause symptoms to develop. Depression is a long-last condition that can have ranging severity. This can cause it to severely impact a person's relationships, employment, and quality of life in its worst state. It can cause a person to struggle with suicidal thoughts or tendencies, making it imperative to treat as soon as possible. With the help of therapy, medication, and other forms of counseling, symptoms of depression can become more manageable. So, any question about depression?
None po.
Okay, next. So, the next type is anxiety. So, anyone who wants to read what's on the slide?
Bayani po.
Yes.
Anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. It is normal reaction to stress and can be beneficial in some situations. It can alert us to dangers and help us prepare and pay attention.
So, thank you, Miss Bayani. So, anxiety disorders differ from normal feelings of nervousness or anxiousness and involve excessive fear or anxiety. Anxiety disorders are quite common, but a surprising number of people do not seek treatment for them. Anxiety disorders can manifest in the form of phobias, compulsions, and panic attacks. They may develop over time due to a life experience or changes in brain chemistry. Anxiety is highly treatable and there are numerous forms of therapy available to those who struggle with it. In some cases, medication may be used to manage symptoms of anxiety disorders and help prevent them from completely controlling a person's life. So next type, bipolar disorder. So anyone who wants to read? Yes, Gerald.
Bipolar, bipolar disorder Bipolar disorder is characterized by manic and depressive episodes. Each person's experience with it is different, and some may end up on one end of the spectrum more frequently than the other. In manic episodes, a person is hyperactive,
So thank you. Thank you, Gerald. So bipolar disorder, like other mental health disorders, can have a genetic component to it, but it can also develop as a result of changes in brain chemistry and environmental factors. Bipolar disorder mood swings can incredibly extreme and may cause to a person to struggle in their work and relationships. Treatment for bipolar disorder often utilizes medication to help regulate mood and counseling to help individuals cope more effectively. So next type, substance use disorders. Anyone who wants to read?
Bayani po.
Anyone who wants to read? Ami, will you read substance use disorders?
Substance use disorders. Disorders often coexist with other mental health conditions. In some cases, substance use develop as an attempt to self-medicate for an existing mental health condition.
So thank you, Ami. So in other cases, a person may develop a mental health disorder as a result of prolonged substance abuse, regardless of which originated first. Side effects of substance use disorders often have a profound impact on mental health and overall well-being. So substance abuse disorder require extensive treatment in order to address, however, those with co-occurring mental health disorders must receive treatment for mental health needs simultaneously. So this dual diagnosis treatment reduces the risk of relapse and improve recovery outcomes because the two often fuel one another. Treating one without the other puts the person at risk or worsen symptoms and poor quality of life. So next type, eating disorders. So anyone who wants to read?
ma'am.
Bayani po.
Yes, Gerald.
Eating disorders are complex conditions that often develop as a result of biological and psychological factors. It may involve behavior such as dieting, binging, and purging, or skipping meals altogether.
Thank you. So many eating disorders are rooted in social pressures, anx- anxiety, depression, body dysmorphia, and other factors that contribute to a person's overall well-being. Treating eating disorders often requires treatment of other underlying mental health conditions that perpetuate it. Therapy and counseling, coupled with nutritional planning, can help a person strengthen their physical and mental health. So next type, schizophrenia. So anyone who wants to read? Yes, Miss Bayani.
Ma'am, schizophrenia is a disorder that causes a person to hallucinate, experience delusions, or convey no emotion at all. People with this disorder often have difficulty They struggle with making decisions, have a hard time managing their emotions, and may have trouble thinking clearly.
Thank you. So, schizophrenia is a serious mental health disorder that requires lifelong care and requires a combination of medications, therapy, counseling, and specialized treatment to address effectively. While there is no cure for it, treatments option for it allow those with schizophrenia to lead productive lives. Okay, next type. Obsessive compulsive disorder. Anyone who wants to read? Okay, it is an invasive set of urges that are repetitive, irrational, and excessive in nature. So this obsessive urge can interfere with everyday life and make it difficult to complete basic tasks. It often has its roots planted in anxiety and requires various forms of therapy to address. So next type, attention deficit hyperactivity disorder. Anyone who wants to read?
Ma'am,
Yes, Gerald.
attention deficit hyperactivity disorder is commonly diagnosed in adolescents. It is characterized by impulsiveness, shortened attention span, and hyperactivity.
Okay, thank you. So those with ADHD frequently become bored easily and may have difficulty concentrating, which can cause them to act out or become disruptive. So depending on the person, medication and talk therapy may be utilized to help address ADHD early on. The earlier treatment is provided, the more likely it is be effectively managed before entering adulthood. So, next type of common mental disorder is post-traumatic stress disorder. So, anyone who wants to read?
Ma'am,
Bayani po.
Yes. Yes, Miss Bayani.
Post-traumatic stress disorder, or PTSD, often develops following the experience of a traumatic event. There is no clear line defining what is considered a traumatic event and what is not.
Okay, thank you, Miss Bayani. So, most commonly, PTSD is triggered by sexual assault, violence, witnessing trauma such as car accident or natural disaster, and being in a war. A person with PTSD may struggle with unwanted memories and nightmares, and they may engage in avoidant behaviors to reduce the risk of trauma. So, trauma resurfacing. And PTSD is often treated with medication and therapy to help a person manage their symptoms and find healthy ways of coping with trauma. In some cases, a person may need to face their fears head on in order to overcome the power it holds over them. While it may not be fully treated by therapy and medication, utilizing both can make life more manageable. So next, common mental disorder, dementia. Anyone who wants to read?
Ma'am Bondok po.
Yes, Bondok.
Dementia is growing as one of the most common forms of mental health disorder, affecting adults today as people are living longer.
Thank you, Ms. Bondok. So, it is a progressive disorder that becomes increasingly chronic as symptoms develop. Comprehensions, memory, language, and emotional and social control can all be impacted. At this time, there is no known cure for dementia, and a variety of disease can cause its development. Every situation is unique, and diagnosing symptoms varies from person to person. Because there is no cure, treatment is typically focused on easing the confusion and suffering of the person. So, do you have any question, class?
None, ma'am.
So, if none, let us proceed to the signs and symptoms of mental disorder. So, these are the signs and symptoms of common mental disorder. So, first is feeling anxious or worried, feeling depressed or unhappy, emotional outbursts, sleep problems, weight or appetite changes, quiet or withdrawn, substance abuse, feeling guilty or worthless, and last, changes in behavior or feelings. So these are the signs and symptoms of common mental disorder, class. So first is feeling anxious or worried. It is characterized by extreme uneasiness of mind or brooding fear about some contingency or worry. So next, feeling depressed or unhappy. It is a feeling of sadness or loss of interest. Next, emotional outbursts. It is also known as emotional lability. Refer to rapid changes in emotional expression when strong or exaggerated feelings and emotions occur. So next is sleep problems. This involves problems with the quality, timing, and amount of sleep, which result in daytime distress and impairment in functioning. So next, weight or appetite changes. A person's emotional state has a significant effect on their appetite. For some people, stress or grief may cause them to eat more food as a way of coping with how they feel, but other these emotions have the opposite effect. So next, quiet or withdrawn. It is a people who keep to themselves to such an extent that it seems a little unhealthy. We can be withdrawn sometimes, especially when we are sad or depressed about something. So next, substance abuse. It is a pattern of drug use that leads to significant problems, such as a failure to attend work or school, driving a vehicle. And next, feeling guilty or worthless. It is a feeling of the desperation and hopelessness. Individuals who feel worthless may feel insignificant, useless, or believe they have nothing valuable to offer the world. So last, changes in behavior or feelings. Extreme mood changes of highs and lows. An example of this is when someone is happy now, then suddenly become very sad. Another example is when someone who is nice and then change into bad. Is the signs and symptoms are clear to you, class?
Yes, ma'am.
So again, class, can you please enumerate signs and symptoms of common mental disorder? Anyone?
Bayani po.
Yes, Miss Bayani.
Ano po, feeling anxious or worried, feeling depressed or unhappy, emotional outbursts, sleep problems, weight or appetite change, quiet or withdrawn, substance abuse, feeling guilty or worthless, and changes in behavior or feelings.
Okay, thank you. Very good. So, so let's move to the prevention in mental disorder. Anyone who wants to read?
Ma'am Gerald po.
Yes, Gerald.
Prevention is an important approach to improving mental health. It means stopping mental health problems from developing, getting worse, or coming back.
So what does prevention mean? Any idea from the class?
Ma'am Bondok po.
Yes, Bondo.
Ma'am, it is the action of stopping something from happening or arising.
Very good. Thank you. So prevention can help all of us whether we currently have good mental health or not. We all have mental health that change depending on what's happening in our lives. So there are three types of prevention. So first is primary prevention, stopping mental health problems before they start. So anyone who wants to read?
Bayani po.
Hey, primary prevention, stopping mental health problems before they start. This focuses on stopping people from developing mental health problems and promoting good mental health for all. So it often targets and benefits everyone in a community. Example include anti-stigma campaigns such as Mental Health Awareness Week or teaching school children about emotions and mental ill health. So next, second type of prevention. Anyone who wants to read?
Bayani po.
Yes, Miss Bayani.
Secondary prevention, supporting those at higher risk of experiencing mental health problems. This focuses on supporting people who are more likely to develop mental health problems, either because of characteristics they were born with or experiences they had.
So thank you, Miss Bayani. It includes LGBTIQ because they have a higher chance of being bullied. People who have experienced trauma, people with a long physical health condition, and victims of hate crimes, for example. So last type of prevention. Anyone who wants to read?
Ma'am,
Yes, Gerald.
tertiary prevention. Helping people living with mental health problems to stay well. This helps people with mental ill health stay well and have a good quality of life.
Okay, thank you. So it aims to reduce people's symptoms, empower them to manage their own well-being, and reduce the risk of relapse. Is the prevention clear, class?
Yes, ma'am.
Okay, let's move to the professional care of common mental disorders. So for the first, professional care, therapies. So therapies can help someone better understand and cope with thoughts, feelings, and behaviors. They can also offer guidance and help improve a person's ability to achieve life goals. So these mental health professionals may also help assess and diagnose mental health conditions. So next, psychologists. Anyone who wants to read?
Ma'am, Bondok po.
Bayani po.
Yes, Bondo.
Psychologists hold a doctoral degree in clinical psychology or another specialty, such as counseling or education.
Hey, thank you. So they are trained to evaluate a person's mental health using clinical interviews, psychological evaluating and testing. They can make diagnoses and provide individual and group therapy. Some may have training in specific forms of therapy like cognitive behavioral therapy or CBT, and dialectical behavior therapy or DBT, and other behavioral therapy interventions. So next, clinical social worker. Anyone who wants to read?
Bayani po.
Yes? Anyone who wants to read?
Clinical social worker. Bayani po.
Okay, Miss Bayani. Sorry.
Clinical
Can you read?
social worker. Clinical social workers are trained to evaluate a person's mental health and use therapeutic techniques based on specific training programs.
Hey, thank you. So, they are also trained in case management and advocacy services. So, next type ay next professional care. Hey, anyone who wants to read?
Ma'am Gerald po.
Okay, Gerald.
Primary care physicians. Prim- Primary care physicians and pediatricians can prescribe medication, but you might consider visiting someone who specializes in mental health care.
Hey, thank you. So, in some states, they are also qualified to prescribe and monitor medications. Requirements are also vary by state as to the degree of supervisions necessary by licensed psychiatrists. So, next. Anyone who wants to read?
Ma'am,
Yes, Bondo.
family nurse practitioners. Family nurse practitioners or FNP can provide general medical services like those of a primary care physicians based on each state's laws.
Hey, thank you. So, like primary care physicians, they can prescribe medication, but you might consider visiting someone who is specializes in mental health care. So, family nurse practitioners and mental health professionals should work together to determine an individual's best treatment plan. So, next, psychiatric pharmacist. Anyone who wants to read?
Bayani po.
Yes, Miss Bayani.
Psychiatric pharmacists. Psychiatrist pharmacists are advanced practice pharmacists who specialize in mental health care. They can prescribe or recommend appropriate medications if allowed in their state and practice setting.
Okay, thank you, Ms. Bayani. So they are skilled at medication management, meaning they evaluate responses and modify treatment, manage medication reactions and drug interactions, and provide education about medications. So many have complete additional training in child, adolescent, psychiatry, substance use disorders, or geriatric psychiatry. So next, anyone who wants to read?
Ma'am,
Yes,
Gerald po.
Gerald.
Other professionals you may encounter. Certified peer specialists. These specialists have lived experience with a mental health condition or substance use disorder. They are often trained, certified, and prepared to assist with recovery by helping a person set goals and develop strengths.
Thank you, Gerald. So these specialists have lived experience with a mental health condition or substance use disorder. They are often trained, certified, and prepared to assist recover by helping a person to get set goals and development strength. So they provide support and mentoring and guidance. So next is the social workers. So social workers or BA or BS provide case management, inpatient, discharge, planning services, placement services, and other services to support healthy living. So these social workers are the one who have authority to assist the people who needs and help with their problem in their community or in their environment. So next is pastoral counselors. Anyone who wants to read?
Bayani po.
Yes, Miss Bayani. So pastoral counselors are clergy members with training in clinical pastoral education. So they are trained to diagnose and provide counseling. So pastoral counselors can have equivalent to a doctorate in counseling. So class, do you understand the common mental disorders and their types, signs, symptoms, prevention, and professional care?
Yes, ma'am.
So, okay, class, if you really understand our lesson for today, let's have an activity called Where Do I Belong? So, for the direction, I will flash a word from our lesson, Common Mental Disorders, and you are going to identify if it is type or signs and symptoms of common mental disorders. So, are you ready, class?
Yes po, ma'am.
Okay, let's begin. Dementia. So, what do you think, class? It is a signs and symptoms or types of common mental
Ma'am,
disorders? Okay. Yes, Ami.
ma'am, it is a type of common mental disorder.
Okay, let's see if your answer is correct. Okay, correct. It is a type of common mental disorder. So next, substance abuse. Anyone who wants to answer? What do you think, class, is substance abuse?
Ma'am,
Is a type? Okay, Gerald?
science po.
Signs. Okay, let's see if your answer is correct. Okay, it is the signs and symptoms of mental disorder. You are correct, Gerald. So let's move to the next word. Emotional outbursts. It is a type or signs and symptoms.
Ma'am,
Yes, Ami.
ma'am, I think it is a signs and symptoms of mental disorder, ma'am.
Okay, let's see if your answer is correct. Okay, very good. You are correct. So it is a signs and symptoms. So next, schizophrenia. Schizophrenia. So is this a type or signs and symptoms? Anyone who wants to answer?
Bayani po.
Ma'am,
Yes, Miss Bayani.
Ano
Gerald.
po, it is a type of mental disorder, ma'am.
Okay, Miss Bayani, let's see if your answer is correct. Correct. So very good, Miss Bayani. Okay, next. Okay.
Doon kami eh. Paano yan? Ano gagawin mo dyan?
So, okay, class, thank you. And I hope you enjoy our discussion and activity. So, I have a question, class. Um, Rather, any question, class? So, if you don't have any questions, then I have a question for you, class. So, first, what is common mental disorder? Any volunteer to answer, class?
Ma'am, bondok po.
Yes, Bondok.
Ma'am, it is a psychological disorder of thought or emotion.
Okay, thank you. Your answer is correct. So it is a so mental disorder or mental illness are conditions that affect your thinking, feeling, and mood and behavior. So they may be occasional or long-lasting or chronic, and they can affect your ability to relate to others and function each day. So next question. What are the signs and symptoms of common mental disorder?
Ma'am, Gerald po.
Yes, Gerald.
Ma'am, feeling anxious or worried, feeling depressed or unhappy, emotional outbursts, sleep problems, weight or appetite, quiet or withdrawn substance abuse, feeling guilty or worthless, and changes in behaviors or feelings. Yun lang po.
Okay, thank you. You are correct. So next question. What is prevention in mental disorders? Any
Bayani
volunteer?
po.
Yes, Miss Bayani.
Ma'am, it is an important approach to improving mental health. It means stopping mental health problems from developing, getting worse, or coming back.
Excellent answer, Miss Bayani. So prevention in mental health aims to reduce the incidence, prevalence, and recurrence of mental health disorders and their associated disability. Preventive interventions are based on modifying risk exposure and strengthening the coping mechanism of the individual. So next question. What is the importance of knowing the types, signs, symptoms, prevention, and Professional care of common mental disorder. Anyone from the class?
Ma'am, ako po
Yes
ulit.
po.
Yes, Gerald.
Ma'am, it is important to know because it will help us to prevent it to become worse and to be aware with this condition. And we can also know the proper treatment. Yun po.
So, nice answer. Thank you for your idea. Class, he is right. It is important because learning about the types, developing symptoms, or early warning signs and taking action can help. Early intervention can help reduce the severity of an illness, and it may even be possible to delay or prevent a major mental illness altogether. Am I right?
Yes po, ma'am.
Yes, ma'am.
So, always remember class this saying, mainam na ang may alam. And always remember class, when we are mentally healthy and when we enjoy our life and environment and the people in it. And we can be creative, learn, and try new things and take risks. And we are better to be able to cope with difficult times in our personal and professional lives. So I hope that you really understand our lesson.
Oh, aye, papay. Mami, oh, aye, papay.
So class,
Papay.
do you have any more questions?
Papay.
None po, ma'am.
Okay, now let's see if you really understand and learned everything that we have discussed in today's lesson. So let's have a short quiz, class. Please prepare a 1/2 sheet of paper. So are you ready, class? Class, please sit properly and do not off your camera during our quiz because this is a live quiz. So okay, let's proceed to the quiz. So for the first question, in your own word, what is mental disorder? Second, what are the types of common mental disorder? And third, it is important approach to improving mental health. It means stopping mental health problems from developing, getting worse, or coming. And fourth, it is characterized by general feelings of sadness, lack of interest in activities once enjoyed, exhaustion, inability to concentrate, and changes in sleeping and eating patterns. And for the last question, it is an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. So, okay, class, stop answering. Please draw an X in the number that has no answer to avoid cheating because this is online quiz. So, you are the one who will check your paper. So, okay, class, here are the correct answers. So, for the first question, this is any answer are valid and correct. And second question, the answer is depression, anxiety, bipolar disorder, substance use disorders, eating disorders, schizophrenia, obsessive compulsive disorder, attention deficit hyperactivity disorder, post-traumatic stress disorder, and dementia. And the third question, the answer is question, the answer is anxiety. So thank you class. I hope you enjoy our quiz and discussion. So for your assignment, please watch this video. So, okay, class, for your assignment, do a research about the classification of drugs. And for the direction, write your answer in a bond paper. Write well and readable. Take a picture of your output. If you have a scanner, scan it and upload it to your template. And if you have a question, just chat with our GC. And the deadline is May 16, 2022 until 11:59 p.m. So that's all, class. I hope you learn a lot and class dismissed. Thank you.
Thank you